Eliseo, thank you for joining the Compass Wealth Conversations. Could you give us a little bit about your background and what you do?
So I'm still working as an emergency department case manager. I'm a board certified case manager, a licensed insurance agent in life and health. I've been a nurse for 32 years. My wife and two daughters are also nurses in mainline health. And I was a mainline health emergency department nurse for 19 years. Now I'm working at an emergency department in central Pennsylvania.
You're also helping some people do some case management in the emergency department, right? Like stress testing, maybe their retirement, because you are life and health active, right? You're using those. So when you're talking to these people in the emergency room, what kind of information are you giving them or conversations are you having there?
Bottom line is that you need to pre-plan before you meet me in the emergency department, because currently the emergency department can't house anybody that is not, let's say, a trauma patient. So if you don't have your plans in place, the emergency department will be charging you $5,400 a day. That's $5,400 a day if you're medically stable for discharge. The doctor has written discharge orders and you feel that you're not ready to leave, or your children are saying, well, what if these scenarios, what if my mom falls again? It's going to be on you. But the bottom line is that we need to make a quick decision medically to see if you're medically stable, and then we're ready to leave. The other thing is, I want to make sure that they understand that there's care gaps based on the medical records that I'm reading from the hospital, from what we have, and also what I've gathered from the other hospitals around the area.
So when you're talking about their plans, you're talking about making sure that their Medicare is up to date, what kind of plan they have, and then do they have any long-term care insurance after that, right? Because Medicare doesn't cover long-term care. I know you know that, but not everyone listening does.
Correct. And it seemed to be the bearer of bad news, but they really have to dig deeper into what their insurance agent mentioned about their long-term care strategy, the longevity, and also their medical issues, because Medicare is not forever care. And that's what people have an idea that, well, Medicare will take care of them be from the hospital and beyond, which is incorrect. And that's where the care gaps occur.
Mm-hmm.
And that's where kind of long-term care insurance fits in.
Right, because I think people get Medicare, Medicaid, and long-term care all mixed up, because not that Medicaid is a bad thing. It comes down to people not having their assets in line, right? Or they're like, oh, well, the government's going to pay for me. Well, that's not probably the best way to go about it.
No, not at all. One of the things that I also encourage them is in the community, check to see if they have a neighbor who is a nurse, because you need a nurse or someone clinical in your retirement roundtable, because everyone is going to be dealing with medical, legal, financial, and most importantly, caregiving issues that someone who is well-versed in those areas needs to be part of your care roundtable.
Yeah, so what we do at Compass is we do with what's called the financial team. So we would bring you in as part of our financial team, right? So whether we're doing the planning, making sure you have income, making sure you have long-term care, making sure that your Medicare insurance is where it needs to be, you would become part of our team and also help them guide through the process, right? So I know, because part of what we talked about before is that you recently took what's called a long-term care claims professional, right? You became a claims professional. So when you're talking to people in the emergency room, could you give me maybe a percentage of people that you talk to that actually have long-term care insurance? And then two, what is the claims professional part of what you just discovered?
So it's rare that there's somebody that has long-term care insurance. First of all, the long-term care claims professional certification, first of all, I passed.
Congratulations.
But it also shows that my passions for the topic. The industry also needs kind of the boots on the ground perspectives. Um, so it's my fiduciary duty as the nurse to make sure that my patients are well aware of the gaps. The, the most memorable um, long-term care claims that I had was one patient had three policies.
3 policies. Wow.
Yes, and one social worker that had two.
Hmm.
And the common thing between them is that they developed Parkinson's, which they, had a clean health when they um, applied for it, maybe 20 years ago. But it really saved the butt.
It does, because Parkinson's is kind of like the new, not the new, but Alzheimer's dementia. They're using it in that category where the average stay is about 8 years, right? So if you're looking, I mean, you, and as well as you know, it's the top of the line nursing homes in the state of PA is where we are. It's about $150,000. So if you're looking at an 8-year stay, you're looking at about like $1.2 million out of pocket if you don't have that insurance.
Yeah, absolutely. And it also emotionally, there's one daughter was crying on my shoulder, saying this is the most unselfish thing that her father did to make sure that she's taken care of, that she can be the daughter and not, the hands-on caregiver because he had a policy after his stroke. So what I do, and I go to the patient and ask him, who's your insurance agent? And I get him on the phone and said, great job, man. Your client was taken care of. Just as a feedback loop, because you don't know, like you won't know how it affects them in the emergency department when you really need it. And they meet me, and I have to create, a long-term care plan, and I'm able to go to my referral sources and stack their community resources and be able to pay for that. It's really a great feeling. So that's why I wanted to pass it along to and CLTC agents like you.
Oh, thank you. But we see it. We see that, 56% of a husband and wife will have some type of LTC event, right? And that's at the cost of possibly 137,000 is the average right now. So imagine where we are with inflation. Imagine where we are everywhere else. Where those prices are going, right? As you know, from COVID, the nursing home situation has changed. People are getting taken care of at home, and you're helping with the people to get that plan started at home as soon as they leave the hospital.
Yeah, and I take that into heart as well because on my days off like this, I do these interviews. I'm also at the office of somebody, basically a stranger that's starting a private duty company here in Wayne, Pennsylvania, and I'm helping them walk through, the insights that I get from the emergency department so that they will have a thriving business because in about 15 years, 80 million seniors are going to try to get into the 80 beds in my emergency department. And the bottom line is I have to be the gatekeeper to send them out to the community with direct hands-on care, and I have to vet out my referral partners. So I want to make sure that this owner has a thriving business and will take care of the direct caregivers,
Mhm.
so that when your clients during time of claims time, that they have vetted or happy caregivers.
Yeah, because we have a common friend in Ali Mazza,
Right.
and you go from some type of home care, and now then people are like, oh, I need to go to a nursing home. Well, how do I figure out which nursing home is the best for us? Who do I talk to? And then that's where we can recommend our friend Allie, or we have Kirsten Bolton and a couple other people that we work with, and you have some other referral partners. But that's what our financial team does, right? We're making sure that along the way, like the LTC is in place, your income's in place. We we deal with Eliseo at the hospital. Then we move over to, hey, we're going to recommend a home care company, and then from the home care company, it's, well, God forbid we have to go somewhere else, right? It just keeps falling in steps along the way.
Yeah. And to bring about Ali Mazik, she was one of my go-to referral partners that I had coffee with when I was working at Paoli Hospital in their emergency department, as well as up on the floor. Um, what I wanted to really just vet her out. And
Hmm.
she has her own circle of network of providers like you, um, that I was happy to refer to her. And I know that I'm handing off the patient to more than capable, you know, care coordinator. And she'll work with the people who she has vetted out in the community, which I can't do while I'm in the hospital. And so we belong to all the Facebook groups. She just recently interviewed me, and also have, I give her ideas. Like, for example, part of what I tell the financial planners to stress test their client's portfolio is just have the client lay down on the floor and have the spouse or family members try to pick them up.
Hmm.
Then they'll start thinking about, oh, yeah, I can do that, or I can't do that. Well, I'll call 911. But what happens if medically they just keep falling? All the specialists don't know what they're falling, but they keep falling at home. What's your next step? How are you going to pay your $40 an hour for 30 days, per year? And what are you going to do from there on?
Hmm.
So that scenario, just start with that scenario. Fall down on the ground or lay down on the ground and have somebody try to pick you up. And that's what I was trying to tell Ali with our interview.
That's a good recommendation. I've never actually thought about using that in a conversation because, you know, usually when people come to me to talk about long term care, or if I broach it in a subject when I'm meeting a new client, it's because they're dealing with their parents or a grandparent or a loved one. I mean, don't you find that most of the time the conversations are with you are the same way, or they're in the hospital already about to start some kind of plan?
Right. It's a lot of falls. And it's complicated with, the anticoagulants that they have on board
Hmm.
that we see in their emergency department. And with that fall, that's the insight that I have that I give out to the referral partners to start stress testing their caregiving portfolio, their finances, his support system, their first, second, third layers of support systems, because caregiver burden is also a major issue.
It's a major issue, and people aren't. I mean, how many unpaid caregivers are there? And it's usually the child or another loved one who actually have to leave their job to come in and start taking care of you, and they're not being compensated, and they're trying to figure it out and piece it together across the board. So if they have that, that plan, the long term care plan isn't always just for the person who purchased it, right? It's for the family and the legacy down the line. Like you said earlier, someone thanked their dad for having that plan. To put that plan in place is a legacy, right? You're not just leaving them money, you're leaving them, this is what I would like done for me. This is the care I want to receive, but I don't want to have you have the burden. The plan is in place. Reach out to our financial team. They know the plan,
Mhm.
right? On top of that, and then they can help guide you along the way.
Right. And that's one of the things that you were asking me about. What can people start right now to plan for that?
Hmm.
And I want people to really think about what 2020 did, which is basically compress the time that um, you need to think about your 2040 healthcare strategy, which is about 15 years from now.
Hmm.
Again, when 80 million seniors are trying to lay their heads on 80 beds in my emergency department. Um, I'm gathering the insights from the 19 years I've worked in all the emergency departments in mainline health, Paoli Hospital, Bryn Mawr, Langton, Riddle. You've seen all the recent hospital closing because private equity has, kind of raided the equity of some of the hospitals. Closure of Brandywine, which I worked before, and just the uh, mergers and acquisition has changed the hands of healthcare.
Hmm. Absolutely.
My insight is that it's going to be eventually the hospital at home, and what does that look like? And how are you going to pay for that? If your daughter is going to be taking care of you hands on, are they going to give up their $200,000 job to switch out to whatever? So kind of strategize, get a long-term care or short-term care insurance, give you the 1 to 2 year runway to think about how else you're going to be able to get paid.
Yeah, you have to look at it because you're already giving us like what we're looking at for 2040
Correct?
because of where all the baby boomers are right now and where all like people my age, I'm 45, 46, we're looking at, God forbid, what happens to something with our parents, right? So now give them another, give the people who are just turning 60, 65, 15 years, we're looking at the same thing all over again, right? And it's going to be more and more. Just like you, my mother was a nurse, like my mother-in-law's a nurse, my mother-in-law, my aunt. I have a family of nurses. So I appreciate what you go through and you're doing even more by explaining to the people what they need to do to check boxes off their list so they're not stuck in, oh my God, I have to go the Medicaid route. I have to spend down all my money. I have to get down to $1,900 in Pennsylvania with a home, just a home, and leave my husband or wife only $126,000 in their IRA. And how are they going to live? It's a survivorship piece also.
I'm telling you, I don't pay attention to insurance. Of course, when I'm working as a nurse in the emergency department, um, and whether it's Medicare Advantage, original Medicare, Medicaid, it doesn't matter to me. I focus to make sure that you have the care that you need from, a professional, subject matter expert on that. I've seen so many iterations of Medicare, Medicaid, Medicare Advantage. It's not foolproof. Again, it's not forever care. And plus, if you outlive your caregiver or your support systems, who's going to care for you? And how can you set up, let's say, a long-term care insurance policy to pay forever, but to make sure that it pays your friends, your neighbors who usually take over, and that issue that all the issues that come to the emergency department that I have to try to solve in about 1 or 2 hours. It really gets complicated.
Yeah, and if people take the time to plan before, it alleviates that complicatedness or complications inside of, hey, what are my next steps, right?
Right.
So, what are the next steps for listeners wanting to know more about what you do and how we work together? Where should they start?
So one of the things that I'm trying to do is just do these community seminars at Bryn Mawr. The board members wanted to do a little bit more kind of seminar of observation versus inpatient with a focus on Medicare. But when I just recently did that, a lot of the feedback that I got was like, nobody really even talks about that. What happens with observation or inpatient, and is insurance really that comprehensive? It is not. It's never meant to be. It's self-limiting. It's just think of it as catastrophic care. So Medicare is care. Medicaid is aid if you fall in the Medicaid qualifications. But then where are you going to get your care? All the skilled nursing facility, just like what happened during COVID. If you don't have the right insurance, when the local short-term rehab facilities are full, your insurance was limited. I had to go look for short-term care facilities that were 100 miles away. And if you had original Medicare, you could do that. But if you didn't have in Medicare Advantage, they have limited network, and basically I sent you home.
Which is scary for people.
Right.
Right? They need to get their rehab. It's 100 miles away. You're not making it there.
No. And the other thing too, again, 2040, everything is going to be stress tested. Even the EMS, even the paramedics. Just imagine, for example, you have a heart attack, or your heart rhythm, you have atrial fibrillation, ventricular defib. Let's say you were followed by a nurse, and your daughter's a nurse.
Mhm.
So they have an AED. They get your heart pumping back. You have return of spontaneous circulation. So you're still stuck to that machine, but what you need is intensive care unit. Well, there's no room. Paoli, Paoli, Bryn Mawr, Riddle, Mackinac, they're all full, and all the hospital beds are full. That's what I'm anticipating. I already saw that in 2020.
Mhm.
I took care of all those patients to try to coordinate the care after the nurses and doctors saved their lives. So lots of things to think about.
Which most people don't, right? We know that. So the stress testing of the retirement income, the stress testing to see if long-term care, at least something, or disability is something that should be in almost in every retirement plan along the way now,
Absolutely.
especially what we're saying looking out to 2040. But in the retirement plan, like it's it's not unaffordable. You can make it work, right? In today's world, you can make it work. There are different products and different ways for you to purchase some type of long term care, whether you go the traditional route, whether you go the life insurance with a long term care rider, whether you just buy an asset based policy, or even if you can't qualify for those, there are annuity products nowadays. There are ways to work around it where to help you structure something where it leaves a legacy for your family, leaves a legacy for your kids, it leaves a legacy for whatever you want to leave that legacy for. But your care is the most important part of that legacy.
Part of what the certification, Brandon, that I learned is um, when it's claims time,
Hmm.
the care plan is can be written by a doctor, a nurse practitioner, a licensed clinical social worker, or a nurse.
Hmm.
I can coach you through the whole process and make sure that you get the claims started sooner than later because you need it, and you're able to get my insight from what maybe something like, say, toileting that can qualify you sooner than later,
Hmm.
right? So that's what I learned from the certification, from that certification.
Yeah, that certification is something I'm actually looking into. I know that you got to take it with Bill,
Yeah,
so I know it's a he's great with his knowledge because he's been doing it for so long.
right.
So I'm looking forward to taking that certification. Um, as we get ready to wrap up, is there any advice or final thoughts that you would pass along to our listeners?
So looking 15 years ahead, the economy is going to be changing. You either need to have a job on the cloud or dirt. The cloud meaning if you're going to be in YouTube, money making on the internet, um, and the dirt means direct care, um, real estate, residential assisted living, whatever you're going to do, you have to try to figure it out because, again, the background of artificial intelligence, you're going to have a discussion about universal basic income or conditional universal basic income. And that is what I'm seeing based on the insight that I'm gathering from, let's say, the 200 patients per day that I see in the emergency department, that they have to quit their job. And they're trying to figure out how to take care of their parents while staying at home and have like 1 or 2 hours to make money so that they can also live beyond what taking care of their loved ones.
Hmm.
So kind of something out in left field, but that's kind of a higher level of strategy that you need to think about aside from long-term care insurance, that how to pay for care at your hospital at home.
That's some great insights, even though looking forward to where it will be in the next 10 to 15 years. Because today we're just trying to have these conversations about long term care, where it gets you, the home care, any type of care. So to push forward 15 years and be like, this is also going to be a part of the plan, because you don't want the states coming in and making taxes that add on long-term care to like they do for Social Security. We don't, because if you don't have a plan, at some point they could add on to the states some type of care because they don't want you to go on Medicaid because it's costing the state money, right? So just like they did in Washington, right? The
I
Washington
was just
Cares
going to
Act.
say about that.
It was what, 5 years ago now, but if it puts the pressure on the state to continue to pay for that,
Yeah.
your insurance is going to be the most important part of anything that you have in your portfolio.
Yeah. And then how does a nurse even know about that?
Yeah,
Because I
exactly.
see that. I have to answer those questions and kind of give them ideas on how to um, have money to take care of parents at home. So I follow those trends. I follow everybody through LinkedIn, and that's what I'm posting. And I bring it about. And before you meet me in the emergency department.
Listen, Eliseo, I appreciate your insights as a nurse. I appreciate as a home care coordinator, and I appreciate your insights to helping people get a long-term care, or at least look into the long-term care and think about it long-term, because in reality, it is the feather cap in their portfolio, and it leaves a legacy to families that you love and care, and that they will care for you. So I really appreciate you having on the Compass Wealth conversation today, and I hope you have you back soon, and we'll have another great conversation.
Thank you for listening to the Compass Wealth Conversations podcast. Click the follow button to be notified when new episodes become available. Visit our website at www.mycfsi.com. That's www.mycfsi.com. Or give us a call at 610-449-9900. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guests and does not necessarily represent the views or opinions of Compass Financial Solutions Incorporated. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Please note that the information provided in this podcast is for general informational purposes only. All opinions expressed by the hosts and guests are solely their own opinions and do not reflect the opinions of any institutions or entities they may be affiliated with. This podcast should not be considered as financial or tax advice. We strongly recommend consulting with a professional financial advisor or tax professional to get advice tailored to your specific situation before making any financial decisions.